Hello everyone, this is Dr. Michael Jones, President of the Medical Exercise Training Institute, and I hope this video finds you and your family as well as your clients and your associates all safe and healthy. COVID-19 has certainly turned the world upside down. It's impacted every continent, virtually every industry around the world. And I'd like to take a few moments to talk about its impact on the rehab in the healthcare industry as well as the fitness industry. Now, I know with the shutdowns that we're seeing, especially here in North America, it has really had a great effect on the fitness industry. Health clubs have been shut down. Many of our medical exercise specialists have now had to shift their training techniques virtually. And with that, some of them have done very well. But we also have seen a proliferation in the number of post-rehab and medical exercise certifications that are popping up. Now, we have no problem with that because we certainly see the trend in the 2020s is toward medical exercise training and post-rehab. And because of what we're seeing now with changes in our economy, this is certainly going to have a huge impact on the health insurance industry as well as the healthcare industry. And we're going to see more clients that are going to shift from traditional healthcare services, physical therapy, occupational therapy, chiropractic care. Those services are probably going to be curtailed faster, which means less visits. And these clients are going to move into the medical exercise or post-rehab or medical fitness industry a little bit faster. With that, because of this proliferation of certifications, we wanted to talk a few moments about the medical exercise or post-rehab real deal. We've seen in some of these advertisements that they're utilizing the terms treatment, patient, they're even kind of alluding to licensure, and we wanted to take a few moments to address that. Now, folks, I'm the guy who started the Medical Exercise Specialist Workshop and Certification back in 1994. This was the first post-rehab or medical exercise certification or workshop any place on the planet. And we've been doing that now for 26 years. We've helped MESs on 6 continents around the world build practices, develop referral relationships with medical professionals. We even have a few that have actually become providers for insurance carriers. That's right, insurance providers. They actually work within the insurance company's framework. So I think we have enough understanding and enough time doing this that we can actually address some of these issues. So the first one I'd like to talk about is this idea of treatment versus exercise. We see this one in a number of ads for these certifications where you're talking about treatment. Folks, as a medical exercise or post-rehab professional, your scope of practice and your role does not allow you to provide any aspect of treatment. You're providing exercise. Usually, not always, these individuals coming to you have been discharged from physical therapy or chiropractic care or medical care. And yes, in many instances, they're referred to you, but they're not referred to you for treatment. They're referred to you for the exercise. Now, some people can say, well, the exercise is treatment, but hold on to that for just a second. I had to correct one of our students the other day who said that she was working with patients instead of clients. You're not providing any medical treatment, so it's not a patient. When you say patient, that means there's a medical process involved. This is a client. You're providing exercise for them. And I know many of you will say, well, but Dr. Mike, exercise is medicine, so we're providing some level of treatment. But hold for 1 second. We had a student call a couple of days ago, and the student asked how she should apply for a job that required a license. And I told her simply, you don't apply for that job. You don't have a license. Licensure is set up by every state here in the United States or territory, every province with our Canadian friends, as well as around the world. The licensure process is normally handled by the state board or the provincial board of medicine in that jurisdiction. And that medical board is responsible for establishing the guidelines for the practice of physical therapy or physiotherapy for our Canadian friends, occupational therapy, chiropractic care, nursing, massage therapy, as well as medicine. With that, the board establishes very strict guidelines on who can sit and take the licensing exam. They establish guidelines on the licensing exam. They establish guidelines on the scope of practice and the role of each individual discipline. And then once you pass all that criteria, now you're awarded a license. The license is much different than the certification. The certification is a certification that's offered by a fitness-based organization or medical exercise-based organization like ours, and that just simply says you've passed the exam. It doesn't say that you now have a license to practice any form of treatment and provide that treatment to patients. let's be clear on this. And we were very clear in the delineation of this back in 1994 and since then, that your role as a medical exercise professional is to provide safe and effective exercise for clients that have been referred to you by doctors, therapists, and chiropractors. You're not providing any aspect of treatment or diagnostic services. It's exercise you're providing for a client, and that's what your certification allows you to do. So when you're looking at the idea of, well, what can I do as far as licensure, you've got to go back to school and attend a school or enroll in a program that now leads you to actually getting a degree in whatever field it is, and then taking the state licensing exam and then being licensed in that state. I just want to be clear on that because I think there's some confusion out there in the fitness industry about that. Certification versus management. When you get certified, the certification is great, but you've got to take that information and now manage your clients to a positive outcome. The doctor, the therapist, the chiropractor, they take all the information that they learn in their educational programs. They take the state board exam and then they start practicing, and with practicing, they're managing their patients to a positive outcome. So everything that you're learning is geared toward the positive outcome. It's not about the certification, it's about the positive outcome. Just like for the doctor or the therapist or the chiropractor, it's not about the degree, it's about the ability to manage the clients. Insurance reimbursement is another one we're hearing about. Yes, we do have some of our MESs that have become insurance providers for various insurance carriers around the country. But folks, let me make sure you understand, this insurance reimbursement process isn't just simply, hey, I got a certification. Somebody else I know got reimbursed from that insurance company with the same certification. I can send my bill in and they're going to pay me. No, you got to prove to that insurance carrier who you are, what you do, why you're doing it to that client. Is it actually working for the client? So you've got a document. You got to explain to them who you are and what you're doing. You're going to have to get a referral from the physician. And with that, this isn't as easy as what some of these certifications are telling you. And then lastly, where you fit in. You're that next level of care after physical therapy, chiropractic, medical care is over. And folks, that world or that realm is increasing every day because insurance carriers are cutting back on everything. Major cuts to home care and skilled nursing facilities occurred back in 2019 or went into effect in January of 2020. So you're going to see more clients over the next several years, and the 2020s will definitely be the decade of medical exercise training, but you've got to understand where you fit in. You're the medical exercise professional. You're the person that steps in after they've been discharged from physical therapy, chiropractic care, medical care. You're not providing any treatment. You're providing exercise. You're working with clients and not patients. And yes, you have a certification. At this point, it's not a licensing. And with that, yes, you've got to get that certification and manage that client to a positive outcome. And if you do, there's a possibility for insurance reimbursement. But folks, this is a long and tedious process to get that reimbursement. So all I wanted to say was, let's be mindful that we're moving the industry into a new realm. And this is actually, we're still in our infancy. We've only been doing this now for 26 years, the entire industry. And with that, we have to be very careful and very mindful of how we present ourselves. We have to be very careful and mindful of how we present ourselves to other professionals. We have to be very careful and mindful of how we structure our professional development. And most importantly, we need to think of the idea that we need to be competent. We need to develop competence to develop the confidence necessary to build a new profession, to communicate and collaborate with doctors, therapists, and chiropractors, to produce outcomes for our clients, but most importantly, to produce high professional standards. And this is where it starts. So we need to understand this is the real deal. This isn't just simply, hey, I'm working with patients, I'm providing treatment, hey, I'm going to get reimbursement from the insurance carrier. It's a lot more to it than that. And the only reason we're doing this is not to say, don't try these other certification groups. No, not at all. There's plenty of room out there for everyone. But we're saying, let's do it mindfully. Let's do it with the idea of building a profession and not the idea, hey, this is the next thing in the industry. I need to hop on this now so I can keep clients coming in the door. Doctors, therapists, chiropractors, they didn't go to school for their stat. They went to school because they had a true interest in being a professional in that realm of that discipline. Let's hope that we continue to do the same thing. So I wish you all the best. Please stay safe and healthy. If you have any questions for me, email me at drmike@postrehab.com. All the best.